You've been told your body is broken. It isn't. You started to believe your body is broken. Something's just wrong with you. And this is your life now. And guys, I just want you to sit with that just for a minute. Every guy I work with walks in with that same feeling. There's something wrong, and it's a mystery, a medical mystery. And I'm just broken. This is unsolvable. Stick with me until the end of this because I want you to be able to see your symptoms differently than when you first started thinking of them. There's one thing in particular that nobody talks about, and it changes everything. Have you ever had the unlucky experience of slamming your pinky toe into, let's say, a coffee table leg? Not like a bump, a slam. You taught that pinky toe a lesson. You smashed the shit out of it. Oh, your whole world becomes your pinky toe, and it is horrific. Maybe it's broken. Maybe it's just all gnarly and bruised. It's swollen, and it hurts like a mud. You know, you've done it. How do you walk the rest of that day? Not well. You're limping. You are figuring out a way that you can still walk, but use that pinky toe as little as possible. And that's amazing. Your body is incredible at cheating, adapting, compensating. And we've all smashed our pinky toe. We've all stubbed a toe, or we've all had a paper cut on our thumb or something. And it's incredible how your body can figure out, ooh, I don't want to use that strategy anymore because it hurts. No problem. I can reorder things quickly and find a different way to do that same thing. Walk, use my thumb, or not. We have this unbelievable capacity for adaptation and compensation, and we do that when our body needs to. Now, interestingly, your body will compensate however it needs to do so to succeed, even if it means to the detriment of another body part. And that's a big reason why guys come to me and feel that they're broken because they do have symptoms in their pelvic floor. But a big reason why is because their body is actually adapting to something else. There's a proverbial stubbed toe that their body is like, listen, nope, I do not want to walk through that thing. And it starts to change how it's moving. Now imagine with that stub toe, what's your foot going to do? It's going to try to get off of that little baby toe because she hurts, right? Try to get off that toe. Well, what's going to happen whenever we get off of that toe because it hurts? Well, that's going to change the shape of our foot. Of course it is. And when we change the shape of our foot, well, then there's assuming your foot is still connected to your shin. If we change the shape of our foot, it's going to change the positioning of our shin bone, our tibia. Uh-oh. Well, if the positioning and the movement of our shin bone starts to change, our knee changes. And if our knee changes, assuming your thigh bone is connected to your shin bone, your thigh bone is going to change its shape and its movement. Oh no, what's connected to your thigh bone? Your freaking pelvis. So if we've got this like adapted, change shape foot that's causing this twist and rotation and new positioning all the way up through our shin and through our thigh bone, eventually, quickly, that's going to land in our pelvis. And our pelvis, instead of being this, ha ha, look at me, our pelvis is saying, ah, crap, I'm on crooked. Mm, okay, well, my baby toe doesn't hurt as much like this. That's good. But man, this crookedness is not really how I like to work. And you know what? I'm gonna have a little opinion about it. I'm gonna start to send off some signals up to this dude's brain and be like, yo, listen, I understand. We're taking it for the team. We're saving this pinky toe, but I don't like my new job. I'm gonna I'm going to tighten up on you just a little here. Let you know this isn't how I want to live the rest of my life. Your body's actually just adapting to something else. Now, in this case, there's an acute injury. Bam, slam my pinky toe. The same thing goes for anything in the body that's just compensating. It's adapting to something that is just not great. It's not optimal. And the body's having to work through that. And that's a really common reason why guys are told, I believe you something is wrong, can't figure out why. It's because there is a series of compensatory strategies, adaptations that your nervous system, for whatever reason, has decided, ooh, I'm going to do that because it helps me do what I need to do today. Here's the second big thing I see in these situations where someone just feels broken and it starts to feel really true. Guys will come into me and they're like, listen, I've seen this provider, that provider, this expert, I've had this test done, that test done, these other two tests done, this one test that really hurts. They come in with this like thick medical chart. And at the end of all of that, I say, okay, so you've been through a lot. What have you learned? And you know what they say? I've learned that we don't know what's wrong. I have a huge list of diagnoses and images and data to tell me there's nothing wrong with me. That's the cliff notes. That's the big takeaway. There's nothing wrong. They can't find anything. Oh man, that's tough. On one hand, hooray, we know a lot of things that isn't. On the other hand, dang it, we don't know what it is. And when we have that feeling of, oh my God, like I'm seeing all of these experts, these people who've been through years and decades perhaps of schooling, and the best they can tell me is, don't know, brother. I'm not really sure what's wrong. Sorry you're feeling this way. Best of luck to you. You can pay your copay at the front. Of course, guys come to me with this feeling of burden, of maybe even like shame, right? Like there's something wrong. And that narrative starts to become really believable. The more images, the more visits that this guy goes to and is told, negative result on the test. Great. You don't have fill in the blank. It's validating and reassuring. It's also crushing. It's devastating because what we want is a solution. We want to feel better. We want to have a plan. And every time we're told, no, it's not that thing, not that thing. No, that looks great. Ooh, this is good. While that's good news, it's also paradoxically kind of devastating news because you walk out of that office saying, what do I do now? There's no plan. And it's really easy to start to believe that theme of, I guess my body is just a broken system. The factory produced a lemon, and here I am in it. Your body is just trying to solve a problem that you and your other providers can't see. That's frustrating, confusing, but that's it. There's something that isn't going to the preference of your nervous system. Your nervous system, the thing that controls everything, your control center. Something is wrong. They've run a diagnostic. The diagnostic has come back. There is an error. There's an error in the code. Something is faulty. We're getting the check engine light. Perfect analogy. My car, the check engine light came on. What the hell do I know what that means? I don't know. I drive a car. I drive it there. I drive it back. I put gas. The end. That is the end. And then a check engine light comes on, and I look at it, and I'm like, uh-oh. So what do? I go to the people that do car stuff, and they take this little gadget, and they stick it in the little thingy. That's what it's called, the thingy. And the thingy sends a little laser beam over to another thingy. And this other thingy says, there's a problem. And I've seen what the thingy says. And it says, there's There's a nondescript, absolutely unhelpful code here. And the code says there's something to be done with the exhaust system. Oh, okay. Well, that's super specific and helpful. Like there's something wrong. It doesn't tell me, oh, replace the gas cap, which turns out will turn on your check engine light. There's an error code. The the body is just protecting something. It's just seeing that, hey fella, excuse me up there, you in charge. Something in here isn't going the way I like it. And so listen, I'm gonna do my best to help out. I'm gonna protect. You need some assistance. And so it starts to find these ways to protect and to adapt. And unfortunately, the body doesn't always choose the most ideal, or shall I say, the option that has minimal symptoms. The body will sacrifice itself in order to save itself on purpose. It has a hierarchy. And if there's something a little bit wrong that your body perceives as a threat, it will do what is necessary, even if it's not a great plan, to try to protect and adapt to that thing that is wrong, even if it means somewhere else in the body, things go wonky. Fourth big point here is what it means to one of my guys who comes to see me for help when they realize they, in fact, are not broken. They are not a medical mystery. Their case will not be written up in some obscure journal and be discussed at conferences. When I can sit with them and help them understand that what they are experiencing has a name, a reason, and there is a solution. Man, when there's a plan, finally, sometimes after years, okay, okay, here's what's going on. Your body's been doing this. It has sucked. Here's why it's doing this, and here's what we need to do to undo that plan. Let's restore the body back to how it used to work before it chose this strategy. That's what I see my patients do when they finally get it. They finally hear an answer and a solution. And then they say something really important to me. Wait, so you're saying all this time there was never actually anything wrong? I'm not a broken system, a broken body. It was just it was just an adaptation. It was just a compensation. It was a strategy. Wait, you can fix that? Favorite moment as a clinician. I love these moments as a clinician because I get to say, yeah, let's fix it. And it's a beautiful thing, right? Like that and sometimes true terror masked well. But that terror of, oh my God, my body is betraying me, melts within a single session. Guys, living in a body that feels broken, faulty, and a betrayal is maddening, lonely, frustrating, scary. But there's a reason. There's always a reason. And that reason is something you can work with, you know? Now, listen, please keep following me. I'm going to keep producing more content, more education, and I really hope it helps you. So follow along, more to come, and thanks for joining me.